My name is Brandy Walls, and I did a case study over a book called Get Me Out of Here, My Recovery from Borderline Personality Disorder. And the author's name is Rachel Reiland. In Rachel's book, she describes herself as not being aware of her diagnosis until she was 29. In the result of her late diagnosis, Rachel went through her childhood and young adult life mistaking her mental illness with her own wrongdoings, until one night when she couldn't function normally. Rachel couldn't grip reality, she couldn't stop her obsessive and suicidal thoughts, and she admitted herself to a mental hospital. Borderline personality disorder is a very serious illness. Most people suffering from BPD have suicidal thoughts, explosive anger, manipulative behaviors. BPD is a mental disorder that is defined by having emotional instability followed by a distorted self-image. However, every BPD patient suffers in different ways. Rachel Reiland describes her BPD as explosive anger, self-destruction, manipulative behavior, and sexual promiscuity, anorexia, nervosa, and depression. The history and development of Rachel's disorder started as young as an infant. Rachel writes in her book, waking up from nightmares as an adult during therapy of all the abuse and trauma that she had gone through as a child. Rachel Reiland suffered from intense physical and emotional abuse. She was not only scolded by her parents for having behaviors, she was also made to feel if it was wrong to be female. Rachel had a lot of disciplinary reports made by her Catholic teachers, but her parents, they never paid them any mind or even punished her for them. As long as Rachel's grades were good, her parents ignored her completely. Rachel's father was a business owner who worked about 80 hours a week, and her mother was a stay-at-home mom whose main focus was her family's reputation rather than her family's needs. Rachel's mother was said to have mental illnesses, but Rachel's father was also raised by an abusive alcoholic who was taught physical punishment as part of life. Rachel was beat more times than she could remember, especially as a child when she would pee the bed or get caught masturbating, which she did a lot of because she wanted attention. This physical abuse aided, or in her therapist, Dr. Pageant's words, it shaped Rachel's BPD. Despite the disciplinary reports made by her Catholic school teachers, Rachel graduated valedictorian. Rachel's BPD started to make its appearance more and more as she got older. Into her late teens and early 20s, Rachel admits to substance abuse and promiscuity. Later on in her life, one night Rachel was with her 2 children, and she had gotten mad at her son and she had hit him multiple times. Rachel recalls his eyes wide and tears just rolling down his face, and she recognized this look. This was the look she had so many times as her father would beat her. Rachel stopped and just emotionally crashed. She immediately had suicidal thoughts. She thought that her children deserved better than her. She would always be an abuser, and she thought that her children would only benefit from her death. She even made plans on how to commit suicide. Something in her told her to call her church pastor, and he talked her into committing herself to the mental hospital, which potentially could have saved Rachel's life. This is where Rachel met her therapist, or as Rachel called her stepdad, Dr. Pageant. Rachel displayed violent acts with nurses in the mental hospital, though. Rachel found herself so overwhelmed one night that she was just running back and forth down the halls, and the nurse had told her to stop, so Rachel decided to throw her MP3 player at her nurse with also a lot of curse words. After Rachel was discharged, she found on her discharge papers a borderline personality disorder diagnosis. Rachel, she couldn't believe it. She had been diagnosed with borderline personality disorder. At her first meeting with her therapist, Dr. Pageant, Rachel tried to deny the diagnosis, and she started to panic that the disorder would ultimately define her. According to Pearson's Abnormal Psychology textbook, borderline personality disorder is a pervasive pattern of unstable and interpersonal relationships, a self-image, affect, and impulsivity. The Pearson also described the symptoms and criteria of BPD as anger, anxiety, depression, impulsive hostility, self-injury, conflicted sense of gender identity, which Rachel definitely suffered from, and drug and alcohol abuse. According to Pearson, some individuals suffering from BPD feel as if they do not exist at all. BPD patients also fear abandonment, causing desperate attempts to remain in contact with others. Idolization is replaced with intense anger and dislike. BPD patients go into dissociative episodes where they detach from reality completely. According to Pearson, borderline personality disorder refers to the border between psychosis and neurosis. Rachel Reiland displays all of these symptoms in her novel. Rachel would get into so many fights as a child in school due to her anger. In one of her memories, Rachel describes herself in elementary school. She's seen herself drawing a picture, and the teacher kept complimenting another child's picture. Rachel just assumed that the teacher, that child, the whole school hated her and thought she was evil, and thought that her picture and herself was not good enough. Rachel then threw the paint all over the other child, all over the teacher, and all over the child's painting. Rachel also accused her husband for using his job as an excuse to get away from her. She had many fights with her husband over such issues, dealing with thoughts that people are after her. Rachel thinks it's because she's evil and hard to deal with. As a result of these feelings, Rachel acts with emotional outbursts and words of hostility and anger. Rachel had such a bad anxiety that she would wake up every night at 2 a.m. and she would go on a 5-mile run in the worst part of the neighborhood, hoping that criminals would see her, and in Rachel's words, take her out of her misery. There was one night that Rachel had an episode and ran out of the house barefoot into the worst neighborhood around. Her husband found her on a bench. Rachel had been in a dissociative episode. Rachel was highly depressed and had many thoughts of suicides, but no attempts. Rachel would self-injure herself. She was anorexia nervosa. She would stop eating. She got down to about 100 pounds during her therapy. Rachel's treatment, that included pharmacotherapy and psychotherapy. Rachel admitted to using antidepressant medicine to help her with her depression. She also went 3 times a week to see Dr. Pageant for her borderline personality disorder. Rachel started in therapy at 29, but she did not get finished with therapy until she was 33, so she was in therapy for 4 years total. Rachel, like most PD patients, was skeptical and did not believe she had BPD, and she did not believe in therapy. And that's because Rachel's father had taught her that therapy was for quacks or weak women. But on the first day of therapy, I remember Dr. Pageant gave her a metaphor to help her realize her disorder. Dr. Pageant told Rachel that she was a diamond, and however, no one, including herself, could see that she was a diamond due to all the dirt and mud covering her up. With every intense session, Rachel forced herself to break down the dirt and shine. In the beginning of her sessions, Rachel thought there was no hope because she still had symptoms, but because she was still suicidal and how she was dealing with it, that's what was changing. Rachel would discover as she reached deeper and deeper into her conscious mind, her unconscious mind would appear, and it would bring back those memories and abuse of her childhood. But some patients suffering from BPD may hear that there is no cure for BPD. However, like in Rachel Reiland's case, BPD can have a great prognosis if properly treated. Recently, research that has been conducted regarding the prognosis of BPD, Collaborative Longitudinal Personality Disorder Study, and McLean Study of Adult Development says the remission rate went from 30 to 50% by the second year follow-up and up to 80% by the 10th year. Also, the research showed many variables that influence the diagnosed outcome of BPD. These variables consisted of family history of psychiatric disorders, older age, extent of earlier psychiatric treatment, and adverse child abuse. Remission from BPD includes psychopathology, personality, and socio-demographic variables. Also, in a 6-year prospective outcome study, 34.5% of patients met criteria for remission at 2 years, 49.4% at 4 years, and 68.6% at 6 years, and 73.5% over an entire follow-up. Therefore, only 5.9% of patients showed a reoccurrence of symptoms at a later time. Rachel wrote this novel, and I think she wanted to raise awareness for everyone having this mental illness, but there's so much more to be said about Rachel Reiland, not just as an author, but as a person. I mean, she displayed so much of her vulnerability. I mean, she dived into her illness and picked it apart and then wrote it down for us to read. I mean, there are so many memories that she has that have to be so traumatizing, and she wrote about them to help others. And she also wrote about the things she'd done to other people, the things she'd done to hurt her own family. I mean, and Rachel Reiland she's heroic for displaying such a side of herself, and that ultimately helps so many people. I mean, anyone suffering from a depressive disorder or a mental illness, I am sure, can relate to this story, and it could possibly heal them or can encourage them to get the therapy that they need. Rachel Reiland in this book, she describes herself as a certain person in the beginning and a completely different person at the end. I mean, for trauma and her BPD to cause such acts that she did made her a different person. And by the end, she was a person that she always wanted to be. She was a person that she needed to be. Every child needs a even playing field, and Rachel Reiland got that at the end with therapy. Dr. Paget described Freud's stages of development, and in one of the stages he says that Rachel never grew out of because she was abused. She never developed out of this stage into womanhood, and that little girl inside her spoke throughout her entire illness. That little girl that was scared, the little girl that refused treatment, the little girl that would call Dr. Paget names, would call him homosexual, would threaten his family. I mean, Rachel acted out so much, and Dr. Paget described this as, I hate you, don't leave me. Rachel, this book I would recommend to anyone, and Rachel wrote at the end of the book the reason to why she wrote this novel, and she put, to serve as proof that miracles too happen, that love can and does heal wounds, and that there is hope for those with courage and fortitude to seek healing. Rachel is not just a victim of BPD, she's an advocate and a survivor. Rachel's story is so similar to so many, and so many people suffering with BPD can relate. Rachel encourages all who are suffering with depression or BPD to seek help. Rachel gives online resources for her BPD at the end of her book, and these include www.borderlinepersonality.ca, www.borderlinepersonalitydisorder.com, and finally www.bpd411.org. That was my case study for Rachel Reiland's borderline personality disorder that she displayed in her book, Get Me Out of Here, My Recovery from Borderline Personality Disorder. Thank you.